Have you ever wondered which organs a human has and which ones you basically don't need? Today we're going to be taking a look at 10 organs you don't need to survive. So stick with us until the end. Before we start, like this video, subscribe to the channel, and hit the bell for notifications so you don't miss our uploads. Now, let's get started. Number 10, your appendix. The appendix is a small tube connected to your large intestine that has a lot of beneficial bacteria in it. However, this organ has no other real purpose. It was thought by scientists to be a useless organ until very recently, when they realized how important it is to our immune system. Although it does play an important role, if it gets infected or inflamed, it can cause appendicitis, which is a serious condition that requires medical attention and often results in the removal of the appendix. And if the inflammation continues, it can rupture, causing fecal matter to spill into your abdomen and making the condition life-threatening. So, although it does have some benefits, it's not absolutely necessary for life. Number 9, tonsils. Tonsils are the small patches of tissue at the back of your throat that trap germs before they make it into your body. They were deemed one of the 5 dangerous organs because they can become infected and cause tonsillitis. This would lead to difficulty breathing or swallowing. And if the tonsils got too big, it could even obstruct your airway. But even if they were removed, your body still has plenty of other ways to fight off infection. Your nose hairs, for example, also act as a sort of filter, along with your eyelashes, which prevent germs from getting into your eyes, ears, mouth, or lungs. If you do get sick, you have white blood cells to fight off any infection. And if that doesn't work, you have your spleen, which filters out the bad blood. Even if you had all of your lymph nodes removed, your body would still have plenty of ways to get rid of infections. Since tonsillitis can be painful and annoying, doctors often recommend removing the tonsils if they get too bad. And if you get them out, you won't die, but it'll probably be a little harder to breathe through your nose. Number 8, the spleen. The spleen is an organ located near your stomach that filters out old or damaged red blood cells and stores blood plasma. Like the appendix, the spleen also contains lots of good bacteria that helps to fight off infection. These bacteria help produce antibodies that identify viruses, bacteria, and other harmful substances and neutralize them so they don't hurt you. However, if the spleen becomes too damaged, it can rupture and cause internal bleeding. In order to prevent this, the spleen can be removed. If this happens, the liver will take over most of its functions. There are some downsides to living without a spleen, though. For example, you'll have a harder time fighting off certain infections, and since it filters out old blood cells, without it, you'll be more prone to getting anemia. You may also need to be careful around cats, since if you're exposed to the parasite Toxoplasma gondii, which they often carry, you're much more likely to become severely ill than someone with a spleen. Number 7, wisdom teeth. These are the last molars that begin coming in when you are still a teenager or young adult. Over the years, many people have had these teeth removed, either because they were impacted or causing pain. Wisdom teeth are considered to be vestigial structures, meaning that they have no real purpose anymore. Our ancestors used to have much larger jaws, which allowed for the full development of the wisdom teeth. As humans evolved, however, our jaws got smaller, leaving no room for these extra chompers. They can cause problems, such as being stuck underneath the gums, causing pain or infection. Or, if they come in normally, they can cause problems with your bite, since there's no room for them. Number 6, ear muscles. Humans have 3 tiny muscles in their ears that allow us to move them. These muscles are called the auriculars, the anterior, posterior, and the superior. Most mammals have these muscles, but they are underdeveloped in humans. They are attached to the malleus or hammer bone in your middle ear. When these muscles contract, they pull on the malleus, moving your eardrum in a way that affects your hearing. Scientists think that these muscles may help protect your hearing if you're exposed to loud noises. When you hear a sudden loud sound, your muscles contract and pull on the malleus, pushing the stapes bone out of the way. This prevents the sound vibrations from reaching the inner ear and damaging the delicate hair cells that are responsible for hearing. However, if you're exposed to extremely loud noises, the muscles won't be able to protect your hearing and you may go deaf. Number 5, coccyx. The coccyx, or tailbone, is the last bone in your vertebral column. Millions of years ago, our ancestors had long prehensile tails that they used to hang from trees and swing around in. Over the years, the tailbone has gotten smaller and smaller. It's now just a small, kind of useless bone. The coccyx does attach several important muscles and ligaments, but it's not really an essential part of the human body. If it was removed, the muscles would simply attach directly to the spine. Many people experience pain in this area, especially after sitting for long periods of time. This is because the coccyx is right where your sit bones would rest if you were sitting down. Sitting for long periods of time puts pressure on the tailbone, causing discomfort. Standing up takes pressure off of it, relieving the pain. For this reason, people who have had their coccyx removed often report less pain in the area. Number 4, your gallbladder. The gallbladder is a small organ that sits underneath your liver and stores bile. Bile is a substance that helps break down fats. Without the gallbladder, your body can still make bile, but it won't be stored. Instead, it'll just be released slowly into your digestive tract. This isn't ideal because you only want to release bile when you're digesting fats. If you don't have a gallbladder, your body won't be able to store bile until it needs to use it. This means that anytime you eat a meal containing fat, bile will be released into your digestive system, which causes diarrhea. People who have had their gallbladder removed often experience this problem. However, over time, the body can adapt, and it won't be as much of an issue. Number 3, the kidney. Now, normally you are born with 2 of them, sitting like little bean-shaped filters on each side of your spine. They work non-stop cleaning your blood, pulling out toxins, balancing fluids, and making sure your body stays in perfect chemical order. But here's the surprising part. You can actually live a healthy life with only 1. Doctors even perform kidney transplants, where someone donates 1 kidney and goes on living almost as normal as before. Of course, having 2 gives you backup and extra strength, but 1 kidney is usually strong enough to handle all the work by itself. So, while the kidney as an organ is absolutely vital, you do not need both of them to survive. Number 2, the urethra. The urethra is the tube that urine passes through when it leaves the bladder. Female urethras are significantly shorter than male urethras. Males also use their urethra to discharge semen. While the urethra is certainly important for urination and sexual reproduction, it's not crucial for survival. Females can live healthy lives without their urethra. Of course, they wouldn't be able to urinate, but they could use a catheter whenever they needed to. Males, on the other hand, would have a much harder time surviving without their urethra. Not only would they be unable to urinate, but they would be unable to reproduce. And number 1, Adam's apple. The Adam's apple is the small bump you can feel on the front of your neck. It's actually the thyroid cartilage of your larynx, or voice box. The thyroid cartilage protects the larynx, but it also makes the voice box larger, deepening a man's voice as he goes through puberty. The cartilage is larger in men than women, because men generally have deeper voices. The Adam's apple is not necessary for survival, but it does serve an evolutionary purpose. Having a lower pitch voice helps men establish dominance and attract a mate. If a man's Adam's apple was removed, his voice would become higher pitched. This could throw off his sexual development or affect his ability to attract a partner. If a woman's Adam's apple was removed, her voice would become deeper. This might help her compete with men for resources or establish dominance over other females, but it wouldn't really help her attract a mate. Which organ surprised you most? Please write it down in the comments. Don't forget to leave a like, subscribe, and hit the bell for notifications. Thank you all so much for watching, and see you in the next one.